so this is the hip stability circuit. This comes right out of the Army PRT book. All right, first one. I'm going to do it in two directions here so you can see the frontal view and the side view. Lateral leg raise. Everything's in a perfect little side plank. Key components here is make sure that you're not dipping down on the shoulder, right? You don't want that shoulder to be popping up towards your ear. Keep it nice and tall. I keep my hand on that top hip so you can keep that hip kind of pushed forward. We don't want to sit back at all. We want to keep forward. Leg up, toe up, point the blade. Okay, so it's almost like pointing your heel, kind of rotation a little bit. Then all you're going to do is up and down. Make sure we're staying tall on the shoulder. Pull your belly button in nice and tight. Okay, another side view here. Move the legs this way. So, boom. Notice body's perfectly straight. Hips can't be back here. Perfectly straight. Nice and tall on the shoulder. The leg up and then just kick it away. Now you're not going to get crazy range of motion. You get all the way up here, you're going to know that your hip's dipping back. Keep the belly tight, point that blade, and just, you're going to feel that burn right, pretty much right where my hand's pushing my hip forward. You're going to feel it right underneath that in your abductors. All right, next one is the medial leg raise. All right, again, perfectly sideways. This foot comes up and the heel plants down just behind the pit of the knee. All right, again, pushing that hip forward, tall on the shoulder, belly tight. Now I'm going to point my bottom foot, the heel, I'm going to point that heel, and now all I'm going to do is pick that heel up. This one's a very small range of motion. Boom. This right here, you're going to feel on that inside groin area, that inside thigh. All right, boom. Yeah. Nice and straight, hand on the hip to kind of support it. Point the heel and flutter it up and down. All right. Next one's a classic physical therapy move. It's called Clamshells. Tall on the shoulder, perfectly straight. All right, then you're going to bend 90 degrees at the knees. All right, don't bend your hips back, just the knees. Then all you're going to do is keep the heels together, rotate the knee and the toe up. All right, if your hand's on that hip, pushing your hip forward, you'll pretty much be holding the muscle that's doing all this good work here. Perfectly straight, bend exactly 90 degrees, keep the hip forward, pick that heel and toe up. Last one is a single leg tuck. Again, perfectly straight. Float that foot about 6 inches above the other foot. Then all you're doing is driving that up like you're doing a step up. Now notice, my knee is going to drive up. The lower part of my leg, my shin bone down, is going to be parallel to the rest of to my other leg. Right? And it's not going down here, it's staying at that level. Drive up and back down. Drive up and back down. Alright, so level here, drive up, parallel to this leg. Not bent in here, not too far out. Right, your knee stays above your heel. Pull that belly button in tight.